everyone. Thank you for the opportunity to let us talk about HPV prevention with you today. I just want to let you know how excited I am about the Cancer Plan Continuum. I come from survivorship care. I used to work on improving guidelines for breast cancer follow-up for survivorship and also for decision-making with end-of-life treatment decisions. So now I'm in prevention, so I've kind of done the opposite of Stacy, and I'm excited to be here today. We want to talk about this incredibly safe and cost-effective public health strategy to eliminate HPV attributable cancers. The focus area for Objective 3.2 is increasing HPV vaccination coverage rates for both males and females. There are many evidence-based strategies to increasing both initiation and completion rates of the vaccine, which is a 3-dose series. This includes educating parents, utilizing vaccination reporting systems, focusing on collaborative multidisciplinary strategies, and implementing quality improvement projects such as standing orders and reminder recall systems into clinics. In fact, some states and cities have already initiated many of these strategies and have seen a tremendous jump in HPV vaccination rates. In fact, Chicago saw a record increase in teens receiving this vaccine in only 1 year's time. Initiation rates increased from 58% to 78% for girls, and from 46% to 65% for boys. This is for 13 to 17-year-olds. In front of you, you should have the handout that references the information and measures that I'm about to talk about in greater detail, so you can reference that. According to the CDC, every 20 minutes, someone is diagnosed with cancer attributed to HPV. This includes anal, cervical, vaginal, vulvar, penile, and oropharyngeal cancers. In Colorado, this is about 465 cancer diagnoses a year. Looking at the National Immunization Survey teen data, which is the NIS teen data, only 63% of Colorado females and 41% of males have had at least one dose of the HPV vaccine, and only 42% of females and 22% of males have received 3 or more, which is significantly below our Colorado Cancer Plan and Healthy People 2020 goal of 80%. NIS Teen is a nationally representative sample of 13 to 17-year-olds where data is collected over the phone. Researchers then confirm with the child's provider, and the data is based off the provider's estimates. However, it's really important to note that the HPV vaccine is actually recommended for boys and girls 11 to 12 years old, as they have a higher immune response to the vaccine than older teens, and most HPV infections occur during the teenage or college age years. NIS teen data does not capture information for this age group. Instead, we can use the Colorado Immunization Information System, which is abbreviated as CIS. CIS is a real-time immunization data system that allows users to determine current vaccine status. However, providers are not currently required to report to CIS. But utilization of this database allows us to look at county and provider-specific levels, which we will most likely see changes in vaccination rates in 1 to 2 years' time. When looking at this data in the greater Denver metro area, for example, as of November 2015, we see even lower rates than what NIS Teen is reporting. Just 30% of females in this recommended age group are up to date with their HPV vaccine. There are multiple reasons why the Colorado Cancer Plan should prioritize this work. Despite the 2012 President's Cancer Panel report urging for increased HPV vaccine uptake, 80% of US adults are still infected by age 50, and we have not seen vaccination rates increase even close to meet our 2020 goals. We are already seeing herd effects in genital wart rates in Denver, and in cities where they have the capacity to measure cervical dysplasia, there's evidence of a decrease in these precancerous rates already. Of note, 80% of HPV vaccination coverage could result in up to 83% reduction in cervical cancer and up to 86% reduction in HPV-associated anal and male genital cancers. If HPV vaccines had been administered to girls who were born in 2000, and at a visit where they had already received another vaccine, 91% of these girls would have already had greater than 1 dose of the vaccine by age 13, representing our missed opportunity rates that are going on right now. The HPV vaccine is incredibly effective in preventing initial infection of the virus, and thereby preventing chronic infection that is the precursor to cancer. The disconnect we see in vaccination rates in practice tells us that our interventions need to be paired with effective communication and system-level changes in order to produce broad population-level improvements in health. The Denver Metro Alliance for HPV Prevention is already developing a metro coalition of medical care providers, advocacy groups, and professional organizations to begin to implement an aligned collaborative approach to change that the cancer plan can use as a catalyst in implementing this objective. Despite this commitment, we're going to see continued pushback from the public due to the misperceptions of the importance of this prevention strategy. Providers also have many competing priorities, and a lot don't have time or the resources to promote the HPV vaccine currently. So with the support of the Colorado Cancer Plan, we can garner buy-in statewide, expand outside the Front Range, and support common partnership solutions to combat these challenges. Thank you for your time. If you have any questions or comments, I welcome them right now.
Is that on? Okay. Could you just clarify what the specific recommendations are for the vaccination? And it's a series of vaccinations starting at what age? Through what age?
Yeah, so you can start the vaccine at age 9. It is recommended for, you can start it then, but it's recommended currently for 11 and 12-year-olds because of the higher immune response and because our analogy is you put your seatbelt on in the driveway, you don't put your seatbelt on in the highway. It's a 3-dose series. You should start it when you're 11. You can start it when you're 9. And it's every couple of months. It will take about 6 months to complete. So by age 13, everyone should have the dose complete.
Thanks for that. I just, a couple of questions to try to put all of this in perspective to see what the coalition should really prioritize. If we were to do this and reach this 80% goal, how many cancers would be prevented? How many deaths would be prevented? And isn't there also an impact on dysplasia and the impact of needing treatment for dysplasia and all that? Can you give us some sense about that? And the second is, what do you think the coalition and a task force of the coalition would do in addition to or to complement the group that's already beginning to address this issue?
Yeah, that's great. Currently, we don't have rates on cervical dysplasia in Colorado, and that is something that we really think is really important because it is the precursor to cancer. Like I said, other states are already seeing decreases in it. Who actually measure this? The cancer registry does not capture this data. Right now, 465 diagnoses, cancer diagnoses related to HPV are diagnosed a year in Colorado. We will not be able to see those for a while because people are getting their vaccination rates as teenagers. Cancer, it's going to take a while to see the cancer rates change. However, that's why we're looking at the vaccination rates because we should be able to see changes in the coming years. Regarding your question about why we want to focus this with the Cancer Coalition is that currently CCPD funds 3 grants regarding HPV prevention, Larimer County, Denver, and then down in Peak Vista Community Health Centers. And because of this area and focus where we're putting HPV, we're worried that this is all going to be in this urban area, and we would love to see this expand statewide. States have already implemented these statewide. They started, for example, in Philly, and then Pennsylvania has really expanded their HPV vaccination rates have greatly increased because of this. And so we're trying to create a common message and goal as a state with this, by prioritizing this rate, we agree that this is a priority, that we should be expanding this just outside the Front Range, and that's what we really hope for. And using our work that we've already done at Denver Public Health, as well as our other partners across the metro area, I think that we already have a stable grounding, and we can use that to just expand our work.
I'm curious why the impact on oral or head and neck cancers weren't listed, because that seems to have a strong HPV connection.
Can you repeat that? Sorry.
Is this on? There you go. Hi. I'm curious as to why impact on head and neck or oral cancers is not listed in here, since there seems to be a strong connection with HPV.
I think our data for the oropharyngeal cancers addresses the head and neck cancers and throat cancers that go with that. So I think it's about 70% is associated with those rates, and so that ends up being kind of a huge percentage in Colorado. I have the data.
I'm just looking at the established need page, and it wasn't listed there as far as the what the vaccination could result in reduction of.
Oh, I see it right here, about 70, in the first bullet point, about 70% of cancers of the oropharynx may be linked to HPV. Is there anything else that you would like to know? And what's also really important is that HPV-related oropharyngeal cancers are more likely in men and women, and they're projected to actually surpass the number of cervical cancers. And these links will be provided to you so you can see the data and the study that's actually mentioned here.
So I now see it on the front page, but it wasn't under established needs, so that's why I was missing from there. Thank you.
Mm-hmm.
Yeah, I can probably tack on just a little bit more to that. We actually did run the numbers for Nicole in the cancer registry, and we found that, again, we in the cancer registry do not collect in situ cervical cancers, so our estimates are somewhat low compared to what it would be otherwise. But we already see oropharyngeal cancers surpassing cervical cancers in terms of HPV estimates.
And if you want this 465, the second bullet, 465 broken down, we have those numbers for you too. How many of those are cervical, which is invasive cervical, oropharyngeal, et cetera, et cetera. Those numbers we have for you.